I'm a family physician, and right now I'm also on the board of El Camino Hospital. And so what the board position involves is setting policy for the hospital.
I am a family practice doctor, and I work at a student health center, and it involves me seeing students as well as staff and taking care of their primary care needs.
I'm the CEO of El Camino Hospital, and it involves, my role is just oversight of 2 hospitals that serve the community of Silicon Valley and the region. And so my obligation is to make sure that, number one, we provide the patients with the best quality care, and that we pay very special attention to their experience and the service they get.
Okay, so I'm the manager of infection prevention and control for El Camino Hospital, both at Mountain View and at Los Gatos, and for all our outpatient dialysis sites. So basically what that means is pretty much what it says. We're trying to prevent any infections from coming into the hospital, and the communicable diseases and infections that we know about, we contain them by.
Disease control and prevention means, in a nutshell, keeping the population, the community healthy as possible.
First of all, in a hospital setting or in a healthcare, what you want to make sure of is that you do no harm. You do everything you can to do no harm to the patients that come to you for a variety of other reasons. And the physicians take a very strong leadership role in this, along with staff and myself, to make sure that we have the environment where people know what the possibility is for the disease that could be contagious, and what kind of protocols and procedures that we put in place, along with education and training to every single individual. So we're talking about, so specific to infection control, how do we contain the issue is, first of all, it's all based in evidence-based medicine, and knowing and understanding what diseases are contagious, what have the risk of contamination, what types of things could, and how they get spread. How does the disease get spread? If it's through bodily fluids, if it's airborne, those types of things. So understanding it. So containing it is first knowing and having everyone trained and understanding. Then you have to make sure that you take the precautions, right? The precautions could be that there might be special clothing called PPE, which is basically protective equipment that a person might use as a barrier. Sterile technique in the operating room to make sure that the surgical site never ever gets infected. So it really does depend on the disease itself, how it can contaminate others, and then knowing what types of barriers we put in place to make sure it doesn't spread.
We practice what's called standard precautions, which means there's 2 types of isolations. One is called transmission-based, which we know occurs in certain diseases. Communicable diseases transfer either by air or something that you contact. Air is something like TB, which is fine in the air, or chickenpox. The flu virus is social distancing, 3 to 6 feet. That's very similar to what we're seeing now in the flu season. Or contact, things that are on the surface, either through someone coughing and not washing their hands and touching a surface. Some germs and viruses can last up to a week. Some bacteria can last for months on surfaces. So we rely a lot on our EBS workers, our housekeeping. They keep the patient's environment very clean. And we also have patients clean their hands, because anything they touch, then if they touch an open wound, that can get infected, or say they have an IV or a catheter, that's how it spreads infection. There's a lot of diseases that we know that patients come in with. It's diagnosed before they come in, or while they're in the emergency department, or in the physician's office. For instance, if you're coming in, we might know that you have tuberculosis. So we know you have a defined disease that requires isolation and containment before you're allowed back into the community. As far as prevention and control, when you come in, we want to make sure that we wash our hands, everyone in and out of the room, and that we just practice good hygiene overall, make sure a patient bathes so that they don't pick up any germs from themselves from other parts of the body. So our goal is really to control any infections that they have from spreading to other people, and then to prevent any new diseases from occurring.
So specifically, it's really understanding the disease and understanding how it is spread. What you want to do is you want to avoid any type of hysteria or overreaction and thinking that everybody then has to have some type of medicine because they have come in contact. We just have to really, really understand the disease, how it is spread, educate the employees about that first. Then you talk about what are the barriers, how do we conduct our isolation techniques, our sterile techniques, what kind of equipment do we need to make sure that we have available and know how to take it on, take it off, and know exactly how to use it. So it really is around understanding how to protect oneself, protect the patient from their family if necessary, and take with the precautions that we know need to be done, and then making sure that we work with CDC and the Department of Public Health to make sure we do consistent standards across the region and across the state. So I think the best technique, and it sounds so simple, but oftentimes it really is your own hygiene. It's taking ownership of your own personal hygiene, your hand washing. When you even, and I'm not going to suggest Ebola, but just how do you protect yourself from illness or contagion, is that you hand hygiene when you're coughing, proper techniques of just simple things around containment of germs, and thinking about where you are and what kind of proximity you are to people that might be otherwise sick. It's just good practical common sense mostly, and then just educating yourself so that, again, to avoid hysteria or kind of an overreaction, understanding what risk you have for exposures.
I think people should do what they do for any other disease, meaning wash your hands. If you're sick, stay home so you don't expose other people. And just taking, it's pretty common sense. I don't think you have to do anything more than we do right now. So if you think you're sick, you don't leave your house, and if it's anything that you're worried about and you've had recent travel, then you just make sure that you go to your doctor to be checked out. But I don't think there's that much more than every day that you need to do.
I guess it's really being careful with who you come in contact with is one thing. And if you are in a place where you find out there's an exposure, I think you owe it to your family, your community and whatnot, actually to maybe self-quarantine so that you don't infect others. One of the things people are finding is that by the time they realize they're infected, they've been staying at home maybe, and now their whole families are infected. Or we know about the nurse who came back here, and it's a tricky situation because we believe in rights of individuals. So when is it okay to forcibly tell people, that you can't be out in the world, and when is it okay to say, for the good of the country or your town, whatever, we need to separate you? Those are big questions, and I don't have the answer to those.
You and I do this together. So we do this to every employee who comes to the hospital. We not only show them how to wash their hands correctly, but we show them how to put on a gown, mask, and glove correctly and take it off. So before you even step foot in a patient's room, whether you work as a nurse, as a housekeeper, as a registration, anything, you know what's expected. So here we go. Let's do a little squirt in your hand. And the idea is that every part of your hand gets covered. So do your palms first, the back of your hands, okay, in between your fingers. Now every single finger needs to be. And as you're as you're doing that, you need to rub really, really good. Okay, can't forget your fingernails, so those have to go in there. And people with watches, we want to bring it down. Okay, so this takes at least 20 seconds.